What a wonderful morning here in Washington, D.C., and what a great event on a very important topic and issue. Thank you all so much for being here. I'm Sandy Markwood. I'm the Chief Executive Officer of the National Association of Area Agencies on Aging. As a membership association, we represent and support the interest of area agencies on aging and also tribal aging organizations. These are agencies that exist in every community in the country to plan and provide services and supports that help older adults live where they want to live, at home and in their communities. We're here today to highlight an issue that is pivotal to the health, the wellness, and the independence of both older adults and people with disabilities, and directly impacts their caregivers. And that important issue is transportation. To highlight the importance of this issue, today we're launching two major initiatives. First, we're announcing the results of a national survey of older adults and people with disabilities and their caregivers that was conducted by the National Aging and Disability Transportation Center, or NADTC. NADTC, with funding from the Federal Transit Administration, promotes the availability and the accessibility of transportation options for older adults, people with disabilities, and their caregivers in every community in America. I should note that NADTC is administered jointly by the National Association of Area Agencies on Aging, N4A, and Easterseals, which helps ensure that the interests of both older adults and people with disabilities are represented in NADTC's work. And secondly, we're also here to announce the launch of NADTC's Every Ride Counts campaign, which will highlight and help transportation agencies promote the services they provide to help older adults, people with disabilities, and to support family caregivers as they try to manage the transportation needs of these populations. For older adults, access to transportation is critical. It can mean the difference between getting to a doctor's appointment or not, getting a prescription filled or not, getting to church or not, getting to the grocery store or not, or just being able to connect with friends and family, which is something that's important to all of us. Transportation plays a critical role in reducing and preventing social isolation. And social isolation is now recognized as a growing public health issue for older adults. In fact, it is now recognized to be as detrimental to your health as smoking 15 cigarettes a day. Access to transportation is a growing need for this nation's rapidly aging population. In fact, transportation is consistently the #1 reason why older adults and caregivers contact the Elder Care Locator, which is the country's only national information and referral resource, which is funded by the U.S. Administration on Aging and the U.S. Administration for Community Living to help people locate aging services everywhere in this country. Without access to transportation, older adults are often left out and they're left alone. Without adequate transportation, even the best community services and supports have little or no value if people can't get to them. Transportation is the critical linchpin for older adults, and as our next speaker will also highlight, it's critical for people with disabilities as well. I am so pleased, it is truly my pleasure to introduce Nancy Gogan, the newly elected National Board Chair of Easterseals, N4A's partner in the National Aging and Disability Transportation Center. Nancy?
Thank you, Sandy. Good morning. On behalf of the Easterseals Board of Directors, Easterseals CEO Angela Williams, and the Easterseals Affiliate Network, thank you for this opportunity to join you today at the National Aging and Disability Transportation Center National Convening. I especially want to thank our NADTC partner, the National Association of Area Agencies on Aging, N4A CEO Sandy Markwood, and our federal partners, the Federal Transit Administration and the U.S. Department of Health and Human Services Administration for Community Living. For those of you who may not be familiar with Easterseals' mission, we were founded in 1919 by Ohio businessman Edgar Allen to help address the healthcare and support services needs of children with disabilities. In 1945, we expanded our mission to include adults after seeing the needs of World War II veterans returning home with disabilities. Today, our national network of more than 70 community providers deliver services to more than 1.4 million individuals annually through programs focused on the needs of young children and their families, job training and coaching, transportation services for adults with disabilities, including veterans, adult daycare programs, camps and recreation, and caregiving support, including respite, and much more. Easterseals celebrates its 100th anniversary in 2019, and we see this as an opportunity to reaffirm that together with both national and local partners, we want to go the extra mile to ensure that everyone has the resources necessary to reach their full potential. And speaking of the extra mile, I'd like to focus my comments on Easterseals' role in supporting accessible transportation options for people of all ages and abilities. As we'll hear today, when the survey results are presented, accessibility is a top barrier to transportation mobility identified by respondents. Accessibility means both physical access to transportation as well as knowledge access. Even if services are available to people, many may not know how to reach them. Many who need rides don't know who to call or what keywords to use in their internet search. An individual or their family members may not know how to find out what's available, who the service is for, when they can take the bus or van or call a volunteer driver, or how much transportation will cost. Recognizing the transportation challenges facing people with disabilities, older adults, and their caregivers, Easterseals has worked since before the Americans with Disabilities Act in 1990 to increase knowledge of and availability of accessible transportation options. In 1988, the Urban Mass Transportation Administration, now the Federal Transit Administration, set aside funding for transportation activities related to individuals with disabilities. Easterseals entered into a cooperative agreement with FTA to administer the project through Easterseals Project Action. In the years that followed the passage of the Americans with Disabilities Act in 1990, Easterseals has proudly continued to partner with FTA and N4A to serve as an information resource, technical assistance provider, educator, and facilitator on the topics of the ADA transportation, customer service, the specialized services for older adults and those with disabilities, student transportation, and capital infrastructure improvements. Now, through the National Aging and Disability Transportation Center, we're providing tools and assistance so that communities can not only implement basic ADA requirements, but go above and beyond to fulfill the true spirit of the legislation. In recent years, Easterseals has emphasized providing an environment where we help people learn, live, work, and play in their communities. And with our anniversary year, we now have a new tagline: all abilities, limitless possibilities. And this tagline is all the more appropriate when you consider that transportation that is easy to find, within reach, and affordable is transportation that's accessible for all. This is where partnerships among our organizations and the partnerships we've formed with nonprofits and private companies through NADTC grantee projects in 15 states and research projects such as the one we'll discuss today are crucial. As national organizations, we have a wonderful toolbox of resources and research to share. However, local leaders and riders have wonderful ideas about their community needs, and it's their feedback that will serve as guides to the type of transportation services most needed in the next several years. The national poll that we'll hear about today is direct feedback, and the Every Ride Counts campaign, a marketing and information template toolkit for small transit, paratransit, and local transportation systems is also a way that we can start to address the issue that many travelers simply do not know how to find out what types of transportation are available in their towns. Edgar Allan, Easterseals founder, envisioned a commitment to serving others. One of his quotes is, "Your life and mine shall be valued not by what we take, but by what we give." Helping transportation providers offer equitable, practical, and foremost, accessible services that meet a variety of needs honors this commitment. On behalf of Easterseals, my fellow board members, and our affiliate network, thank you again for the opportunity to partner with you over the past 4 decades and into the future. I look forward to hearing the poll results and your reactions as to how we can work toward fewer barriers and provide more possibilities for people of all abilities. Thank you.
Thank you so much, Nancy, and thank you to Easterseals for being such a great partner on the NADTC. So now about the survey. NADT conducted this survey for several reasons. First, while we think we know what the needs and perceptions of older adults and people with disabilities and their caregivers are in transportation, quite honestly, there was never really a survey done that actually captured it from their own perspective. So we wanted to make sure that that happened. And we also wanted to learn about the experiences and perceptions of older adults and people with disabilities and their caregivers, what they have of the local transportation options they have in their communities, whether those options exist or they don't exist in rural, urban, and suburban parts of the country. Our hope is that as a result of the survey, NADTC, N4A, and Easterseals, and transportation agencies will be better equipped to foster public policies that help meet current and future needs of older adults, people with disabilities, and to support their caregivers living in communities anywhere in this country. To give us the details about the survey, I'd now like to introduce our first panel of experts. First, I'd like to introduce Mark Richards of KRC Research, the polling firm that conducted the survey, and you'll hear about that in just a few minutes. But as I introduce Mark, he is a sociologist with nearly 3 decades of primary research experience and has conducted research studies across diverse and hard-to-reach audiences to identify insights to advise public and private clients. And we are so glad that Mark and the KRC team were able to help us with this survey. Next, I'd like to introduce Virginia Dyes and Carol Wright Kinderline, co-directors of the National Aging and Disability Transportation Center. In addition to being NADTC's co-director, Virginia is the director of N4A's transportation program, where she oversees N4A's efforts to support transportation within the National Aging Network. And Carol is the co-director of NADTC, is also the director of Easterseals Transportation Group, where she helps ensure that the transportation needs of people with disabilities are met. So I'd now like to turn the podium over to Mark, Carol, and Virginia to discuss the survey results. Come on up.
Good morning. So we have a terrific study to present to you today, and I'm just going to introduce what we did so you're aware of the method. So what's really great about this study is that we approached it in a very comprehensive way. So you have a 360 snapshot of the topics from the various audiences. So we looked at 3 audiences. In your packet, you've got a description of this. If you'd like it, you can also have a copy of the questionnaires in the order and the exact wording and the full studies. But the 3 audiences. So first, we interviewed a sample of 500 adults, older adults, defined as adults 60 and above. The second sample, another sample of 500 adults, were adults with disabilities, 18 to 59. So we've covered 18 and above, people, older adults, and people with disabilities. Separately, we talked to a third sample of people who care, family caregivers, who care for one of our two other audiences by assisting them either in providing transportation, or arranging transportation. So we're getting the perspectives of the three audiences that we could compare and contrast. So you'll be able to look at this. The three samples were drawn nationally, so we have a national perspective. The samples are demographically representative of the audiences in the country, and we have a terrific representation, of course, from rural areas, small towns, suburban areas, and urban areas. If you'd like to look more carefully at the demographic composition of each of the audiences, you can turn to the back of the study, and it's laid out there in larger detail. One other thing that I'll point out is that a good portion, about 30% of older adults, live with disabilities of one sort or another. So there's overlap in the audiences, and you'll see in some cases there are similarities that are associated with living with a disability, and there are differences, and you can pull those out. So we also found that caregivers, the individuals with disabilities, have a higher proportion of people who help them and who care for them. And this is data here you can look at. If you have any questions about the methodology, we'll be happy to talk to you more about that. And now, the more interesting part, I am going to, Carol and Virginia are going to tell you more about the study.
Thanks, Mark. I'm Carol Wright-Kenderdine, and first of all, I want to join Nancy and Sandy in thanking you all for attending this morning. It's fitting that this particular briefing take place this week as we are honoring former President George H.W. Bush. We honor him for his service, but we also need to call out and to acknowledge his remarkable contribution to accessible transportation through the signing of the Americans with Disabilities Act. His commitment to equality for people with disabilities improves transportation and accessibility for all Americans. However, as the survey shows, there's more work to be done. While you have copies of the entire survey assessment report in your folders, Virginia and I are going to highlight 8 key findings as takeaways for you this morning. The first one, most older adults and younger adults with disabilities drive their own vehicles or ride with family or friends. Across age and disability, most anticipate a time when they will no longer be able to drive, and they believe that finding alternative transportation will be difficult. While this doesn't come as a surprise to many of you, some of the statistics might. Over 70% of older adults with disabilities and younger adults with disabilities already have cut back on their driving. Older adults who gave up driving did so because they were no longer comfortable, while those with disabilities gave it up due to physical and medical challenges. Those with caregivers, 73% of whom were older adults and 77% younger adults with disabilities, are especially concerned about not being able to find other alternatives for transportation. Most of them tell us that alternative options for getting around are good, but could be better, and only a quarter say they have excellent options. Options are especially limited and very different for those living in rural areas. Number 2, caregivers play a pivotal role in helping older adults and individuals with disabilities meet their transportation needs, and most are happy to help, but find that providing for or arranging for rides to be extremely time-consuming. 2 in 10 older adults And 6 in 10 people with disabilities have a caregiver. Most caregivers live with the care recipient or nearby. Caregivers spend 5 to 10 hours a week just either providing transportation or arranging for that transportation. 86% of caregivers are quite concerned about the safety of the person that they care for if they're still driving. And most expect a time when the care recipient will no longer be able to drive and are concerned about what that means for their transportation options. I think it's important that we hear from the people themselves. Caregivers of older adults with disabilities have this to say. The person I care for is starting to forget to turn headlights on or look for oncoming traffic at intersections. Another states that she's not confident in her reaction time. She doesn't like to drive in bad weather or on busy streets. Still another describes their person's driving habits by saying he cannot see clearly during the day and almost not at all if it gets dark suddenly. He's overly cautious and has poor reaction time. And still one more says, my biggest concern is that this person doesn't realize how compromised their driving has become. So we see that there are very serious and very realistic concerns that caregivers have for the people that they're providing transportation for now, even if the person is sometimes driving themselves. We also hear from other caregivers, more public transportation and affordable options are frequently mentioned as ways to help caregivers. 28% of caregivers feel like they're overwhelmed with the responsibility of having to provide that transportation for someone else. One stated, I don't live all that close, so I would love to see a service that would transfer her without my help, since taking time off from work is stressful. These are the realities that caregivers face when they're trying to provide transportation for loved ones. The third main point is those who give up driving face big barriers to getting around. They can no longer do things that they need and want to do. As a result, they face physical isolation, frustration, they feel dependent and trapped. Those who've made changes to their driving because of a visual, a physical, or a medical challenge have cut back, and now they only drive when necessary, or maybe they avoid driving at night. Older adults, when they look at when they might have to quit driving, estimate that they'll have to be able to stop driving around the age of 80. And it's funny when you look at the survey results because it's always somewhere down the road. While younger adults with disabilities estimate that they will stop at age 60, which also for most of them is somewhere down the road. Close to 9 in 10 who stop driving have been negatively impacted, from being isolated to becoming dependent on others. This limits them in living their lives to the fullest, and as the survey said, makes them feel frustrated. Most tell us that it will be extremely difficult to find alternative forms of transportation when they give up driving. What is it like not to drive? People with disabilities tell us in their own words. A 34-year-old with a disability stated, I can't go to social events unless the person driving me gives me a ride, unless the person giving me a ride wants to go. I'm stuck places until whoever drove me wants to leave. I don't get to pick where we go most of the time. That's truly life-changing. Another said, I'm unable to go anywhere by myself, such as a doctor appointment, a hair appointment, dentist, grocery shopping, or personal shopping. It takes your independence away. This is not something that the rest of us experience on a day-to-day basis. It truly is life-altering. This is a difference for those people that the rest of us don't have to experience. We just take for granted that we can go where we want to go, when we want to go, and get in our own independent vehicles and get there. And the fourth point, most older adults and younger adults with disabilities who don't drive are not using public transportation. About 3/4 of adults with disabilities of all ages ride with family and friends, compared to just over half of those with disabilities. About 1/3 of younger adults with disabilities use public transportation, ride with a volunteer, and/or use special transportation services for people with disabilities. Only 15% of older adults use public transportation, and even fewer use special transportation services or ride with a volunteer. Not driving is a huge barrier, especially for younger adults with disabilities. Barriers include expensive and sparse transportation options. Even if transportation is available, it's a problem for many people to access. All of these are key findings that we want to make sure to highlight for you. I'll now turn this over to Virginia for the remainder of the key findings.
Good morning, everyone. Continuing, and very much related to Carol's last point, the issue about fewer people living in rural areas and small towns saying that their transportation alternatives are good. That's almost half of older adults, 49%, and 45% of people with disabilities in rural areas saying that that's so. But let's hear from them, because I think that they say it most clearly. And what's very interesting to us is that there's a great deal of interest in the use of public transportation. So an older adult says what we need is an affordable transportation services for senior citizens and the handicapped, especially in rural areas. A younger adult with disabilities talks about living in a small town. We only have one company with 2 vans that pick people up. I live in the country, and they don't come out this far. We need help in rural areas. I'd like to say that's an unusual statement, but I think that in our work with the NADTC, we've heard folks express this many times in various and sundry ways. An effective transportation, public transportation system that runs frequently rather than occasionally, one of the older adults who responded says, and buses that run on weekends. There are no buses that go between local towns on the weekend, and the buses that do run in the town often don't run on Sunday. So people are stuck at home. They do what they absolutely have to do, but anything else is not done. And Sandy mentioned isolation at the beginning of this event. It is something that really does affect everybody. You don't have to be older to experience isolation. Many younger adults with disabilities are also experiencing this. Finding number 6, older adults and younger adults with disabilities who don't drive face many barriers, including access to affordable transportation alternatives. 40% of older adults and 38% of persons with disabilities express this need and say that they don't have good access to transportation alternatives. Our poll verifies, I think, what we already know. People who are driving tend to modify their driving long before they totally give up the keys. They find ways of getting around. They don't drive at night. They only drive places that it's absolutely necessary for them to go, again, adding to that picture of isolation and dependency. And while they depend on their families and friends, they often will not ask to be taken to places that are just fluff, just the kinds of things that we do when we live our ordinary lives. I think it is important to point out, as many of the people in this room already know so well, Giving up driving is a major life event for people. It profoundly affects people's lives going forward. And even though we are all in here dedicated to working to increasing transportation options, we've still got lots of work to do. Those who give up driving report feelings of isolation, dependence, and loss of enjoyment. A younger adult with disability captures this feeling. I've lost independence, spontaneity, pride, a sense of accomplishment. I have to prearrange everything and rely on others to get me places and wait for me and then drive me home. So you can imagine the level of enjoyment that you have if you're afraid of inconveniencing somebody where you are. And an older adult with a disability, age 75, points out that he is currently relying on his wife to get him to various and sundry places, and reports that it sometimes makes him feel helpless. We also found, much to our dismay, that there is no single source of go-to information resource for alternative transportation options, and that most people are turning to family and friends. We also found out that family caregivers often don't know about the resources. 43% of older adults and 48% of persons with disabilities say that who they're relying on are family and friends. Now, those of us in this room know that there are numerous services that have been created to fill some of those information gaps, particularly mobility managers whose job it is really to work one-on-one with individuals and help them figure out what resources available in the community are going to work for them. We know that, though, mobility managers don't exist everywhere. However, there are area agencies on aging, centers for independent living, public transit agencies, aging and disability resource centers, information and referral. All of these services are set up to provide information to the public and to individuals who are aging or experiencing disability about the resources available in their community, including transportation. So clearly, this is a wake-up call. This is a message to all of us that we really have to figure out ways to more effectively get the word out. As many of these respondents expressed, this is a dire need. If I get to where I'm unable to drive myself, an older adult says, reckon I would have to think about moving closer to town. That's not an option at this point in my life, nor do I want to do that. A younger adult with disabilities. There should be more public transportation. Maybe information should be made available through social media and the news. And finally, a caregiver for older adults suggests a list of transportation services. These are simple requests, and we all are working hard to fill those requests. But again, it's really something that we really need to spend some time on and figure out why our messages are not getting across. Services available that are meant to fill these needs are just not being used by many people. And the majority of older adults and younger adults with disabilities say that they expect transportation options in their communities to stay the same or to get worse. Many would be comfortable, many report that they would be comfortable using public transit, taxis, Uber and Lyft, other kinds of resources if they were available and if they knew about them in their community. But many report not being aware of these services or not feeling like they will work for them. Again, a wake-up call. So I'm really proud at this moment to be able to announce that we at the NADTC are launching a national campaign called Every Ride Counts that is really designed to work not just at the national level, but particularly with communities, because transportation is a local thing. It's very different from county to county, within the city and outside the city, et cetera. Most older adults and people with disabilities who are seeking this information really do need additional help to pinpoint where that information is in their community. And so the campaign includes a number of different materials that are online and can be downloaded, including postcards, flyers, posters, and social media messages. These can be customized with local information, their logo, the name of the organization, and most importantly, contact information. And local communities can use these materials, which include a variety of images and a variety of messages, to best meet their needs. What message is it that they need to get across? How can they most effectively reach the people living in their community and ensure that they're well aware of the resources available? So with that, I'm going to stop and turn it back over to Sandy.
Thank you, Mark and Carol and Virginia, for giving us the survey data. It's really exciting. But now that we've heard about the survey data and the perceptions, well, we really want to hear about the perceptions and the needs of older adults from themselves. So we'd like to show you a short video that was produced by Double R Productions that highlights older adults, people with disabilities, and also their transportation needs and how important transportation is in their daily lives. So let's see the video.
I'm 66 years old. I have open angle glaucoma, and over the last 12 years, that's affected my ability to travel.
I'm 81 years of age and suffer from poor vision.
I'm a caregiver for my 89-year-old mother who has late-stage Alzheimer's.
I'm a young 71, and I am totally blind and also a survivor of a cerebral aneurysm.
I'm 68 years old. 2.5 years ago, I wound up in intensive care for 2 weeks. They were under the impression that I might not walk again. That's where my transportation needs have arisen.
I help other people explore ways to get where they want to go.
Every ride does count. This National Aging and Disability Transportation Center campaign aims to help older adults and individuals with disabilities. The goal? To learn about and become comfortable with local transportation options that are available in their communities.
I would feel that I was caged in, locked in. I gotta be where everything is accessible. So I'll stay around the city.
Urban areas often provide a variety of options for transportation. Without access to options, life would certainly be different and more difficult. Access is critical for older adults and individuals with disabilities as they stay connected to the community and get to much-needed appointments.
I would probably be stuck at home, like a lot of other individuals who, for whatever reason, cannot get out. I guess I'd be watching television throughout the day, bored to death, and not being able to do the things that I would like to do.
You get pretty lonely at home all the time. I mean, I can remember a time when I was living in New Hampshire. It was just after I got my first seeing eye dog, and there was no transportation.
Isolation, absolutely, and exclusion would be the two huge issues that we're working to prevent. Isolation is really deadly to people, and we don't want that to happen. We want people with disabilities and older adults to have access to all the community activities that all of us want to be a part of.
The problem is both with control and with your independence. I can't, for instance, if I were going to go someplace and I'm going to stop at the store and get a loaf of bread on the way home, I can't do that sort of thing. It's I've got to plan it out. And like we say, with Metro Access, you have to let them know a day ahead of time.
I live in one county, she lives in one county. She sees physicians in both counties. It really takes its toll if, you get something that pops up and you weren't planning for it and there's nobody available. And you just can't drop mom off and expect that she's going to get where she's going to be.
A variety of transportation options and help with learning how to use them are available in most communities around the country. Every Ride Counts and the National Aging and Disability Transportation Center aim to help these communities spread the word about these programs. Because we and the older adults and people with disabilities who can use these programs know that every ride counts.
I think the video really gives us a deeper understanding of the critical access, to reliable transportation, how important that is in people's lives. And in saying that, there is more information in your packet about the Every Ride Counts campaign, and we hope that you take that with you and that you use it and that you join us in this important campaign. To focus on the importance of transportation beyond the video, though, we have some real community representatives in this room who we've invited here to tell you their story about the importance of transportation. All of these people are experts in transportation, some because they want it to be, and others because they have to. And so I would like to take this time to introduce our expert panel of community representatives to you. First, we have Carrie Diamond, the Transportation and Volunteer Specialist at the Greater Wisconsin Agency on Aging Resources. As part of NADT's expert panel of professionals in the field who help connect older adults and people with disabilities to transportation, Carrie has provided invaluable support and input into the creation of the Every Ride Counts campaign. Next, and you all can just come on up as I introduce you. Next, I'd like to introduce Marion Kindig of Bethesda, Maryland. And Marion is an older adult who will share her experiences in accessing transportation. And we're just going to wait a few minutes so that we can help Marion get to the stage. And we also have with us John Losky, who's the Director of Marketing and Communications at the Area Transportation Authority in Pennsylvania. And John has become a great friend of the NADTC too, and he will share with us his experience with helping older adults learn about the transportation options that are available to them. He will also give us an overview of the value of the Every Ride Counts campaign resources and will have to transportation agencies. And finally, we have Gwen Graves. You may recognize her from the video we just saw. Gwen is a caregiver to her mother who is living with dementia. And I might add, nationally, 60% of people who have Alzheimer's and dementia are living in the community. So Gwen will share with us her role as a caregiver that she plays in coordinating transportation for her mother. And as you heard in the video, Gwen does this pretty much on her own. So now, as we help Marion to the stage, I would like to turn it over to our panel of community experts.
Great. Thank you very much, Sandy. My name is Carrie Diamond, and I'm with the Greater Wisconsin Agency on Aging Resources, and I work with mobility managers and aging network professionals in the field throughout Wisconsin. And I have to say that access to the expertise and resources like the Every Ride Counts campaign by NADTC are invaluable to the state and local practitioners that I work with. Having been part of the creation of these materials, the messaging was really important to our work group. It was purposely designed to empower people to make their own travel choices, to not dictate what is an acceptable trip, to reduce the stigma of transportation, and to highlight the importance of staying connected. It was recognized that these tools may not resonate for all markets, but having diversity in messaging while consistency in the campaign will allow for broad use across regions and states. A recent study that was done in Wisconsin by the Survival Coalition, which is a network of disability advocates, highlighted the message that every ride does count. Anne from Madison says, "I don't understand the sorting between wants and needs. Rides help my son live his life." And Marlene from Amherst Junction, "Transportation is the most important component of living a good life. Ask anyone who can drive, has reliable transportation, and financial resources to use their personal mode of transportation, how their life would change if they no longer had it or had to live in the shoes of someone without transportation." I'm passionate about this because we see too many people isolated, too many people not living their fullest life because they have no way to get around. This year, most of Wisconsin counties updated their public transit human services transportation coordination plan. 3/4 of the counties in Wisconsin identified that marketing and getting the word out about their services was a goal that they needed to work on in the next 5 years. For example, Rusk County, it has 14,755 people. One of their goals is to develop and implement a media campaign explaining that public transportation is for everyone and all should use it. This makes the Every Ride Count campaign perfectly timed and a great fit to help even the smallest county accomplish their goal. Having easy to use and consistent materials across programs, regardless of the different services that are offered, has value for the Wisconsin statewide network. I have the privilege of working with fantastic local agencies who are on the ground solving transportation problems, creating innovative transit services, and working one-on-one and one by one, getting people where they need and want to go. I'm excited to go back to Wisconsin to share the Every Ride Counts campaign materials with this network to help them help the ones that they serve. Thank you.
Hello, I'm Marion Kindig, and I'm here to tell you that there's a big difference when you're driving your own car and you have to rely on other transportation. For example, you can just get into your car and go from A to B to C to D to E, and it's no problem. It's an easy thing. Whereas without your car, getting just from A to B is a big deal. So, you know, like in one day, you could get all kinds of things done if you have your own car. But if you have to rely on transportation, it could be, one, costly, and secondly, not that available. Now, for example, they have the Senior Connection, which is a very nice organization, and they have volunteers who will take people to only a medical appointment or else they'll get food, but that's it. Well, what if you need to go to the hairdresser? It's not available, or maybe you need to go to the dry cleaners. It's not available. So if they could, let's say, expand the information to the public, requesting more volunteers, maybe they could expand it beyond those two services. That would be a help. Now, there's also available Metro Access, and sometimes they're good, but sometimes it's a real problem. For example, on this one trip that I had, I was going about 9 blocks, and that should have taken maybe 12 minutes. I was on the van for almost 5 hours. And, you know, it was so bizarre, I called Mr. Wiedefeld. And at first they thought I was making it up because it just sounds so impossible. But then when they started checking the tapes and the telephone calls, they realized, yes, she was on the van for almost 5 hours. And they had a special meeting for their executives to show them what might happen, and please don't do it again. So, you know, it is very important to have as much transportation available for people as possible, and also with an idea toward the costs, because let's say on Metro Access, it's generally $13 round trip. That's to go to one place. If you expand it to B, C, D, E, then it gets to be really expensive. So it really does limit what you can do. So I think what you people are doing is a great thing for us to, just help us get around, because it makes a big difference when you don't have your car. So thank you for listening, and thank you for what you're doing.
My name's John Lossey. I'm Director of Marketing and Communication for a Rural Public Transit Authority. The authority was created in 1976. At the time, it was considered a pretty visionary idea. It's situated in north central Pennsylvania. It's called the Area Transportation Authority. It's led by a young man named Michael Imbrogno, who was the visionary leader, really, who was taken on staff early on when ATA was pretty much a cooperative where riders would take out a membership and become part of a transit system in order to get to work. But the commissioners in the 6 counties recognized this was an opportunity because they were working together in so many other regional projects that a solution might rest with a regional transportation authority that would integrate all of the demands that we were facing, especially with rural transportation isolation. I remember the PBS came in and filmed the ATA system in 1981. The actor Lorne Greene narrated and talked about the White House conferences on aging and how America was coming of age. Little did I know that Lorne Greene was talking about me coming of age in 2018. So I'm particularly encouraged by what I see with this campaign that's coming. I think you will enjoy a lot of support from rural transportation authorities and projects, rural providers. From the rural standpoint, I think it's someone has said, it comes at the right time and for the right need. And what you found in your survey, and clearly you've done the science, and it resonates with me. In spite of all the years and efforts we've made, we still regard the communication challenge as foremost. We just had a statewide hearing. The SIL programs had a statewide forum, open forum in our county just Tuesday. And this very thing, transportation and transportation information remain the primary concern of people with disabilities and seniors. So we're committed to that. Just to give you an idea of how large we are, we cover 5,000 square miles. We have about 460,000 passenger trips per year. We are enthusiastically participate in the thing called the Persons with Disabilities Transportation Program, which is a Pennsylvania program that is much like the Shared Ride program. It's funded under the state lottery. Been very beneficial. We estimate that since we were involved in the year 2000, I think it was, this program was launched, some 350,000 rides under the Persons with Disabilities Transportation Program. Under Shared Ride, we've tried very hard to keep the costs down. In the case of our system, our average rate per fare per shared ride is about $5.30. We think this makes a difference in the lives of our neighbors and friends who need and enjoy the mobility that they get from the program. But this doesn't mean we're resting on our laurels or assuming that our job is done. Far from it, because we hear from not only our riders, but our non-riders, people who are interested in our service. We believe in total immersion in our community. We participate in a lot of community expos where we present information on our transportation program, and we still find people are not quite sure how to use our service, and we'll keep trying. We just finished our strategic plan for ATA for 2023. Seems like a long way off, but it isn't. The years pass very quickly. But we're renewing our commitment to the communication component and how important it is. So we've added to the staff. I don't think that's a signal they want me to retire, but we're committed to. I was usually a one-man show for a while, but now I have an assistant working with me, and we're looking at this project as being an important one for next year, and we're all in with you. Like I said, we are very much involved with our local SIL organizations. We have one that's locating in our transit center in St. Mary's. And of course, I'm on the board of our local SIL. It's actually a 6-county SIL, much like the ATA is a 6-county authority, helping them with their strategic plan. And transportation, once again, is the primary concern. So, like I said, we look forward to the remaining events today and what we'll learn. And I just want to compliment the quality of the work that I see as a communicator, sometimes an amateur communicator, but the photography, the design, the word choice, it's all there, and I know it's backed by sound information, and that's why we take value. You know, last year, I know I'm talking too fast. Last year we had a program, and it's ongoing, using NADTC's program on transition. That is before you give up the keys. You know, have a plan for your transportation. And it's been received very well throughout our communities. And so we expect more from this newest effort. It's very worthwhile. Thank you.
Good afternoon, everybody. My name is Gwen Graves. In 2016, I became a caregiver. That was not my intent. My mom, who lived with my sister, was supposed to be moving to California and decided that she didn't want to go. So my aunt offered her so that she could move in with her in Bethesda, and we thought that would be great. We thought we mapped out a transportation plan. Mom could use Metro Access because she was very social. She went to church every week. She had a little seniors modeling group that she was active in, and we thought we could use Metro Access to get her around. And I also looked online, and I saw that there were certain services like the cabs and the volunteer services. However, what we found out that in doing this and working with Mom, I noticed some changes. And that's when we saw her doctor and we found that she had Alzheimer's. That was something we weren't expecting. That immediately ruled out a lot of the transportation ideas that we had, because with having Alzheimer's, I did not feel comfortable with placing her on Metro Access because I did not know the level of training. You could not be guaranteed that she would get where she was going. She would be fully cognizant, and there was no one really to ride with her all the time. When I looked at the volunteer services and the cab services in Montgomery County, they're only within the county. I could not find anything other than Metro Access that went outside of the county. And we who live in this metropolitan area don't live within Prince George's County or Maryland and DC. We crisscross back and forth. For example, my mom has doctors. She has the same major primary health provider, but she goes to offices within Montgomery County and in Prince George's County. So with me being the sibling that was here, and I have a brother here and I have a cousin, we sort of divvy up some of the responsibilities. I would handle the medical and other things, and they would care for some of the social activities, make sure she got to church on time and those kinds of things. And I have a lot of experience in working with, because this caregiving thing became overwhelming. So our county was very good at offering some workshops, which I went to and I learned, and I've called both areas on aging, and people are pretty good, but the one thing that they never talk to you about, how you're handling transportation. So that's not something that readily pops up. Most people are talking about housing and some of the other services. And as for the primary care organization, they diagnose a person with Alzheimer's, and then you're on your own. There are no caregiver supports, there's nothing. You just And when you talk to the physician, their recommendation is, well, we'll give you a referral to a clinical social worker, and the clinical social worker says call the county. So you're kind of in a loop, and so you're trying to manage this as a caregiver. You've got something that you weren't expecting. Most seniors don't plan for having Alzheimer's, so you have a financial burden, you have a transportation burden, you have this person that you love who sees that things are slipping away and things are out of control and their emotions are all over the place. So you're trying to work through all of these things. One of the things that I find, and even for friends who have medical problems, we need a good, affordable transportation program that works within the metropolitan area that will handle elderly and handle disabled, because Metro Access is there. And I have several friends who would use Metro Access, but the rules are, you know, you can live here, but Metro Access won't come here. So when my mom was in her previous residence, she could use Metro Access, but she moved down the street, just a couple doors down the street, and then she was out of zone, and she couldn't use Metro Access, and she didn't have Alzheimer's there. So there are a lot of things that need to be done so that people will have access to transportation. Now, this puts a major burden on me and also on my family, because as a result of a medical procedure, I lost use of vision somewhat at nighttime. So if there's an appointment that we have to get for mom that's in the evening, I can possibly get her to the appointment in the beginning, but I have to rely on a family member or pay someone to come to get her up and take her back to Rockville. And recently, to keep mom engaged, we were able to get her, we've been trying for a while to get her into a senior adult daycare program. And one of the problems with that was that a lot of them did not offer transportation. So we found one that offered transportation, and my plan was that, okay, I'm gonna go up and they're gonna pick her up about 8:30 in the morning. So I wanna be up there before 8 o'clock to make sure she's dressed and she's ready to give my aunt some relief. And then my husband says, well, I have to drive you. And I went, why? Why do you have to drive me? He says, because in order with the traffic to leave from Fort Washington to get to Rockville, you're going to have to allow at least an hour and a half plus, and it's dark when you leave in the morning, and you can't drive in the dark. And I completely forgot about that. I'm used to being able to manage where I'm going, and I think about it in the evenings, but not in the morning. So I understand when you have a medical problem that comes to you, because when I first experienced this, I felt like a little caged animal because I was cut off. You know, the summer months are better, but the winter months are tough. And so combining the transportation needs of my mother plus my physical problem that I have now, that gets to be a lot. And I've been fortunate that my husband is very supportive. He'll take me, my daughter will take me, and sometimes with some of those visits, you know, particularly with mom has a setback because she has more than Alzheimer's. She has, at 89, she has other issues that are there. And when something goes off kilter, you know, she sometimes has with a medicine adjustment, we may have to take to the doctor every week for blood work and those type of things. So if there were a transportation system that I could pay for, that I would know would get my mother there, would be there with her, would be paying attention, I would pay for those services. And a lot of things when you're working with elderly, they come out of your pocket. I mean, we're willing to pay, but we just need to have them, we need to know about them, and they need to be readily available, because I've looked on a lot of searches and I can't find things, and sometimes maybe the people who are even working in the agencies aren't aware of them. So it's my hope that this program will bring things to the forefront. It'll make it easier for people who are at their wits' end to get some information to help them provide the care that they need for their loved ones. Thank you.
Thank you all for sharing your important perspectives. Now we have the opportunity to take some questions from the audience. So if you could, as you ask your question, if you could please introduce yourself and your agency. And I know that we also have potentially some folks on the phone. So anybody in the room have any questions of our incredible community panel? And also we have our representatives from our research organization here. So if you have any specific questions about the survey, you can ask them as well. So questions from the audience? Oh, come on. It's Friday, I know, but okay.
Hi, Jana Leinert with AARP's Public Policy Institute, and wonderful panel. It's so good to hear from people who both work in this area as well confront the challenges every day for good perspective. I am dying to understand better as to what some of the technological glitches were behind being on a bus for 5 hours. If there's any more information that could be shared on that.
Well, the way it happened is when I got on the bus, they, instead of taking me to my destination, which was about 9 blocks away, they picked up somebody else, and that person was in the wrong direction from where I was going. So then I thought, okay, it should be not too much longer from here to there. Then, instead of going to where I was going, they picked up another 2 people more away from where I was going. So then, this happened a 3rd time, and then I called them and I said, okay, by now where I was going, which was closing at 5 o'clock, and it was almost 5 o'clock, could you take me home instead, because there's no point in our going there? And they said, fine, we just have to pick up one more person and then we'll take you home. So I said, are you sure? Yes, we're sure. So they pick up this one more person and they said, now this person only has to go a few blocks. So we're going further in the wrong direction. And then we're driving and driving and driving, and I'm calling on my cell phone saying, what is going on here? We're going in the opposite direction from where I live. So this went on. They said, well, it'll be soon. We'll get there soon. We'll get there soon. After we were driving, it must have been 45 minutes, and I just kept calling. And that's why this was all recorded, so that at first they didn't believe me, but when they listened into all the calls, they knew that it was legitimate. We were almost in Anacostia, where we were dropping this person off who was supposed to be only like 3 or 4 blocks away. And then we only started going home. So it was long distance from there to Bethesda where I live. So it was almost 5 hours on that van. That's how that happened.
I am so sorry.
It was pretty bizarre.
Great. Question?
Yes, good afternoon. My name is Rick Stelton. I'm with FTA's Office of Research and Innovation. And I'm sorry, for one. Is this still okay? I'm sad and I'm angry at hearing your story, Miss, but I'm also hopeful. I'm hopeful because, we are, in our office, very dedicated to the idea that, that complete trips that are effective for everybody is where this country needs to go. Right? And when we think about that complete trip, we're thinking about things from, as has been pointed out on this panel, even having the confidence to believe that a trip is possible. Being able to plan for one, to conceive of the ability to go to more than one place in a day, to not take 5 hours to get someplace. We're seeing some real progress in that, thankfully. We have some demonstrations going on where people have been able to go to both, say, a movie theater and an art show in a day, right? That shouldn't be hard, all right? But we know it is. So I just wanted to say, how touched I am by hearing your story, how inspired I am. I'm sitting here texting my colleagues back at the office saying, like, this is blank ridiculous. So thank you for that, and thanks everybody for exposing the challenge that we face here, and I hope also to be able to have some conversations about some solutions. But, ma'am, I'm really tugged by your story.
Yes. As a matter of fact, I had heard later that they had an executive board meeting of all the top Metro Access executives to listen in on all the tapes of what was happening. So this shouldn't happen again, but at least they had this big deal meeting to try to straighten it out. But, I know the story sounds preposterous, and it was, but it did happen, and it's all documented.
Great, thank you. And thank you, because I know that FTA is really committed to ensuring that that situation doesn't help, but really through your support of the NADTC and the Every Ride Counts campaign, that we can really change and expand transportation options for older adults and people with disabilities. So thank you. We have a question here.
Hi, thank you all for being here today. My name is Heather Zaccaro. I'm with the National Complete Streets Coalition. And my question is particularly for Marion and Gwen. Thank you both for sharing your personal stories. Putting aside the obvious answers, reliability, getting you where you need to go in fewer than 5 hours, if there's one change that you could make to the way that we approach public transportation to make your lives and your mother's life easier, what would it be?
Well, for one thing, maybe as far as money goes to pay for these trips. For example, Metro Access charges up to $6.50 as far as so most of the trips that I go on would be $6.50 in each direction, which is $13 per trip. And every time you stop and go somewhere else, that would be an additional charge. So it gets to be very expensive. So for one thing, if they could have something that is not quite as expensive as that. And then in other programs, such as a Senior Connection, if they could do things like maybe advertise more to get more volunteers, because there are always more people needing the rides than there are volunteers available. So these people are very nice to volunteer their time, but most everybody's busy, so that is a limited option. So then instead of just having medical appointments and food as the only two options they can do, maybe they could expand that to say, I need to go to the hairdresser, I need to go to the dry cleaners, I need to do an event at the National Press Club, whatever, so that you have more options available. So those two things I think would be very helpful.
Gwen?
For me, since my mom has dementia, and there are a lot of patients who have dementia, it's important that anyone who's providing a service, be it a volunteer service or paid service, has some type of training and know how to handle that, because you need to be able to recognize that something's going on. If they're a little agitated, there are different things that may be coming. I was always afraid if I put my mom in a situation, she may not end up where she was supposed to go, because she may say, well, no, I want to go do this or something. So you need some training. That's always been a big fear, that maybe they didn't realize if you put her on Metro Access or any other volunteer organization, you can't drop her off at the front of the doctor's office. She's got to get, because as many as times that we go to the doctor, she can't navigate her way from the front door to where her doctor's office is. And she has to have someone with her all the time. So if you're dealing with anyone like that, you have to realize that even though, when you first meet my mom, you're not going to know that something's wrong. It's only after a little bit of time. She can't get there on her own, and she's going to need that supervision.
Okay. Anybody else have anything to add?
In our business, we're always dealing with technology, new technology, and the sophistication is growing, but situations like we've heard described can occur, and I'm pleased that the management group really massed on the problem to determine just what happened there. Oftentimes when a new technology is introduced in a transit system, there are problems that can arise that, just transitioning from one software to another. And this happens often. I've seen several transitions in my time that can be very complex. But the one thing that's useful is in the rural areas like ours is that our drivers know our passengers, and they know when they're driving by a stop where the passenger could get off, where their destination. And sometimes they'll call in for an adjustment on the schedule, because the scheduling software is fast moving toward artificial intelligence in terms of what it knows is happening out on the system. And it's quite extraordinary. And as you can imagine, we can watch our bus out on the system moving down the streets and down the lane and so forth. So just one quick story. Lori and I passed through a neighboring transit system in Altoona yesterday, and we stopped at a place called Dunkin'. I don't know if you've heard it for lunch. I think it was Dunkin' Donuts, they call it Dunkin'. But it was pretty clear when we were there that it was a gathering place for seniors, disabled seniors. And they were gathering, and the place was filling up. One of the seniors actually paid for part of our lunch because we allowed him to go ahead of us. In any case, I saw a vignette, a scene where a driver from the Blair Transportation Paratransit is helping a gentleman get off the bus, and he's eyeing the front door of Dunkin', and the driver and he, just before he assumes control of his walker, the driver and he shake hands, a hearty handshake. I've arrived. And it was really heartwarming for me to see that, because I know that goes on in our system, where I think, again, an integral person is where the service is actually delivered by our drivers. And so that's my story. And I hope the technology improves. I think it will, where there's a lot of exciting things going to happen. But we have to be on our guard for mistakes that occur as well.
Great. Carrie, did you have anything? Any other? Oh, we have a question right here.
Heather Foote, Capitol Hill Village. I'm the Transportation Outreach Manager. This is an exciting event, and I really look forward to reading the full survey. My question is for Mr. Richards, and it entails something that we've encountered a lot in our small trainings on transportation options and tech-related skills building, and that is reaching out to accessible populations that may be difficult to reach out to. And how did you handle that in terms of your survey methodology? It must have been challenging. I'd really like to hear more about how you identified the populations that you were going to include in the survey.
Here you go, Mark.
Correct. That is an important challenge and an important consideration. So the first thing that we did is we conducted the survey using a mixed mode methodology. So the survey was conducted both online and by telephone. So there were two options, and within those two options, essentially you can reach all audiences. Now, what we know about the older adult population and the population of people with disabilities is there's a somewhat lower utilization of the internet, of online. But it still hovers around 60%, so it's still quite good. And it's increased quite a lot in I would say, the last 6 years. You've seen growth in use of the internet. So that's the primary method. Then the other thing is in each of the questionnaires, you'll see at the beginning of the questionnaire, there are questions that people self-report about their personal situation and their choices. So people had told us whether they had a physical disability or a visual or hearing disability. But the main thing that made it especially accessible was the mixed methodology, I would say.
Great. Thank you, Mark.
You're welcome.
Any one last question, because I know we've kept you over, but are there any other questions from the audience, and are any questions from the phone? All right. Well, for those of you who are remaining for the convening after this briefing, there'll be a deeper dive into the survey and certainly into the campaign. But on behalf of the National Aging and Disability Transportation Center, on behalf of N4A, and also Nancy, speaking, if you don't mind, for you and Carol, on behalf of Easterseals, I really want to thank you all for being here for this really important event. And, you know, as you've heard, you know, transportation is the linchpin whether you're an older adult or a person with disabilities, and quite honestly, for all of us, to be able to fully, really experience in a positive way the communities that we live in, to be able to live the lives that we want to lead. And what we've heard is there are obstacles to that. But what you've also heard from both the poll and also from this campaign and the commitment from the Federal Transit Administration, and I also know we have a representative, Sherry Clark, in the room from the Administration on Aging, is there is a commitment to be able to address these important concerns. So I hope that you will take the survey information, the poll information, take it back to your organization, but most importantly, I hope that you will join us in the Every Rides Count campaign, because working together, we will really make a difference for older adults, people with disabilities, their caregivers, and quite honestly, for ourselves. Thank you so much.